shortage of nursing staff continues to be a concern. The Democratic Alliance says Gauteng requires additional 2,000 intensive care unit nurses. It says there's been no training to upskill nurses for the past 3 years. To discuss this further, we're joined by the DA Gauteng Shadow Health MEC, Jack Blum. Mr. Blum, thank you very much for your time here on eNCA. 2,700 ICU nurses, that is the shortage. How did we get here?
Well, just incredible, and we're not training enough nurses. Even when we were training nurses in Gauteng, it was only about 50 to 70 ICU nurses a year. But what happened is that training was transferred to the education department, and there's just been incredible red tape from the South African Nursing Council. We're not training any new nurses. Now, the figures that I've got is, I think, the ideal number in relation to what we should have to our population. Ideally, you should have in an ICU ward 1 nurse per patient, and in a high care ward 1 nurse for every 2 patients. But all we've got in the public sector is 639 ICU nurses, and even about more than 300 vacancies. So, we even have vacancies for ICU nurses that haven't been filled, and we have this massive need.
Surely this contributes then to people dying before their time.
Well, absolutely. ICU care is absolutely essential, obviously for emergencies, but also for post-operations. And our waiting lists are enormous. I think there's something like 20 to 30,000 people waiting for operations in Gauteng. There's been, a backlog partly from COVID, but part of the reason why we can't drastically cut the backlogs is that you need ICU beds after major surgery. So surgeries delayed, people frankly die if an ICU bed is not available. And here we've got more than 300 vacant ICU posts in Gauteng, and a massive need for training to get to the ideal number, and we haven't trained since 2019.
That's such a grim picture, Mr. Blum. Did COVID-19 also contribute, because ICU, for instance, and intensive care units are where a lot of critical COVID-19 patients went, and nurses also obviously got infected. Some of them got infected and then passed away. So is the number, the shortage that we're seeing, did COVID also contribute to that?
Well, the shortage really is because we're not training, and we haven't done any training since 2019, and that's inexcusable. And what the DA is advocating is that we cut the red tape and accredit the training programs, and and make sure that we can train the nurses that are required. But it's just senseless that the private health sector can train far more, but they're limited by the SA Nursing Council. So I think both private and public need to get together, train the specialized nurses that we need. And this is a worldwide shortage, actually. And there's a looming crisis. Nurses retire. And frankly, if we don't employ them in South Africa, we also, a lot of our qualified nurses aren't happy here and they go overseas. So we need to improve working conditions, train a lot more specialized nurses, and cut the red tape and provide decent care. This is critical care. These are people, life and death is dependent on whether they get decent care in an ICU bed.
And I can imagine those who are in the system and the fatigue that they are experiencing, because as you said earlier, the ratio should be 1-to-1 in ICU and 1-to-2 in intensive care. So clearly some of these nurses are expected to look after 6 or more patients at the same time. So I can imagine their fatigue as well. And this is when, nurses make mistakes, and then stories come out, news comes out about negligence, but actually their hands were tied.
Well, that's correct. I mean, it's just wrong that we have instead of a 1-to-1 ratio in ICU, you have nurses looking after a fair number of patients, and they can't devote the 1-to-1 attention that is required. And of course, that does count as medical negligence. And of course, our medical negligence cases are absolutely soaring. But just think of the patient. someone whose life could be saved, and it's not happening, or the medical outcome is bad because they didn't get the care that could have made them better. So I think this should be a wake-up call, actually. These figures, I think, are just for Gauteng. So just imagine countrywide. And this is a countrywide issue. It's the National Health Department and the National Education Department need to get together and expedite training of nurses. It's just incredible that for the last 3 years we're just not training any ICU nurses as well, and that can't be allowed to continue.
During legislature sittings, Mr. Blum, have you had a chance perhaps to ask the new Health MEC about this issue? Maybe has she contacted the National Department of Health to see if they can assist? Because this cannot be it, especially for a province like Gauteng that houses hospitals such as your Steve Biko and your Chris Hani Baragwanath that also, cater for the entire continent, not just the country.
Well, yeah, I asked the question, and part of the reply was, what they were trying to do about. And they said, yes, they're pushing to accredit certain programs. And I think this has just got to be pushed as much as possible. But even when it's accredited, they're only going to be accredited to do about 70 ICU nurses a year. So I think we need to drastically increase the number of nurses that we train every year. And in general, as I said, this is just specialist nurses, but there's a massive crisis of other nurses, so and a worldwide problem as well. So, wake-up call, I think this is what it should be. I will continue to engage with the Health MEC in Gauteng, as we have the largest population and the most hospitals and most affected, but it's a countrywide issue, and the DA is pushing in Parliament for a resolution of this as well.
Right. As you said, in general, South Africa has a shortage of nurses, and also because it's an international problem, it's quite scary, especially looking at the fact that these nurses and doctors have been asking for an increase, and that is why maybe some of them are motivated to go overseas where they'll feel a little more appreciated. That was DA Gauteng Shadow Health MEC Jack Blum speaking to us there.